Thank you for coming to this event today that's celebrating the initiation of the Center for Advancing Multimorbidity Science. This is a very important event for us to launch this P20 Center.
One of the main advantages of the center is to build interdisciplinary relationships across the university that strengthen the science. So we might have engineers, computer scientists, physicians, clinicians especially. We need our clinicians to tell us those problems that are most deserving of study, and that's the real advantage of a center, is building that infrastructure across campus.
Multimorbidity science is the care of people with multiple chronic conditions, and what's exciting about this center is that it's going to fund research for our junior faculty that will focus on caring for people with multiple chronic conditions. We already have clinical track faculty who are out there being primary care providers for this type of patient. Patients don't present with just one problem. They usually present with multiple conditions. For example, someone with heart disease might also have obesity, diabetes, maybe some kidney issues. We treat them with therapies that hopefully work across multiple conditions.
A lot of disciplines have incorporated higher analytics into their methodologies. For example, engineers, robotics, computer scientists. But in the nursing discipline, we're used to the more linear analyses, and just learning that incorporating these more advanced techniques, I think, will advance the science of nursing a great deal, and also will benefit the patient population immensely.
We want to get the young nursing researchers hooked up with some of the top level, especially the top young data science people that we have primarily on the academic side, in management sciences, in computer science and engineering, in statistics and biostat. You need to understand from the data what has happened, what worked, what went wrong, why it happened. In a particular situation, you need people that can do predictive modeling to tell you what's going to happen next. So that's the data mining, machine learning type technology. And you need prescriptive analysis to understand how you can get the best outcomes for the most people once you can predict what's going to happen. And the focus is always on, can we make better decisions?
So the primary purpose of the pilot administrative corps is to provide mentoring to the pilot trainees and help with team development activities to prepare these investigators to become successful independent researchers who can conduct research to predict and profile patients' experiences, symptom experiences, and then ultimately to be able to tailor interventions more effectively to address the needs of this population.
The purpose of an enrichment program is to expand the research environment and network of the P20 investigators, build research teams, and bring the research of the P20 investigators to the attention of the wider research community. We hold a writer's workshop where faculty and postdocs bring their manuscripts that are nearly ready for submission to journals. We problem solve issues that come up when completing a manuscript, and we also do a mock review. The second thing that we're doing is a developing scholars group. It is a group where we build survival skills for people who are becoming members of the academic community. The enrichment activities at the college will also include hosting visiting scholars, collaborating with the other corps in developing a lecture series, and in also conducting annual grant writing workshops.
I'm very excited about us having a P20 center. First, nationally, it gives us some networking with other nurse researchers doing similar kinds of work or complementary work, so that's always exciting. Internally, I think I'm really pleased about it because it provides funding for junior faculty in this area, and the area that we've talked about is individuals with chronic conditions with multiple symptoms. It gives us the opportunity to fund over the 5 years about 6 or so junior faculty doing significant research in this area. And that's exciting because if they get a P20 grant, that's going to be a nice stepping stone for them to develop their program of research further into our series grants and other kinds of grants.